According to the guidelines and best practice, we are strongly recommend if you are going to have infusion 500 ml or more from blood and IV fluid, they are recommended to warm it by warming a device up to 37 degrees Celsius. And the reason behind that, there are multiple clinical studies showing or proving that if we are do the infusion of cold blood or IV fluid, it will enhance the incidence of unintended hypothermia. Unintended hypothermia has multiple complications. Some of them are considered major complications, looks like cardiac events, surgical site infection, blood loss and blood transfusion, and some of them are minor complications, looks like chirping, for example. So in TRIM we have the 3 Ranger blood fluid warming, the very simple way. We need to understand what are the technology, how to operate it, what are the tactics behind the Ranger blood and fluid device. So at the beginning, the technology of the 3 Ranger rely on dry heat technology. Dry heat technology means that we are not using any water base as the technology, and there are inside 2 aluminum plates, 2 conductive aluminum plates, which is, you can see it's a black one. This will exchange or transfer the heat from the aluminum to the cassette. This is what is called the heat exchange. So there is no direct touch or there is no direct contact between the aluminum plate and the fluid inside the cassette. Okay, so don't worry about any complications could happen for the fluid or the blood fluid, because the presence of heat exchange between the aluminum and the cassette. Then the setting temperature of the device 41 degrees Celsius. This is the device temperature, not the temperature of the fluid reaches the patient. According to 3 manufacturing, the temperature reaching the patient varies between 36 to 37 degrees Celsius. So if we are talking about IV fluid, which almost stored at 21 degrees Celsius, blood product almost 4 degrees Celsius. So by using the Ranger, we are guaranteed that we deliver the warming device or warming fluid and blood up between 36 to 37. So at the beginning, we just do the attachment of the power supply, and then we have different cassettes. We have pediatric, standard, and high flow. Pediatric to the pediatric and neonates, it will provide you with flow rate up to 100 ml per minute. Whenever you are starting using the Ranger, you need to be sure that the height of the Ranger from the floor not exceed 112 centimeters, and this is something related to the gravity and the priming of the cassette. So the maximum height from the floor 112 centimeters. This is 112 centimeters, and you have the IV clamp, so you can fix it very well. And there is the holder of the bubble trap. This is meant to be used for the bubble trap. This is the part. So first of all, we need to, we have this trap. The infront slot, this is mainly for the cassette, okay? And the back one, this is for the cleaning cassette. Every device from the Ranger in the box have 5 cleaning cassettes, totally different from this one. 5 cleaning cassettes to do maintenance and cleaning for the device from the inside, and the insertion will be from the back slot, okay? This is for the cleaning cassette, but for the current cassette that we are using with the patient, will be attached through the front slot. You need to be sure that the label will be up, and then make it an assembly way till the end of the cassette. This is how to do insertion for the cassette. It's very important to make sure that everything is secure. So we have 2 lines. We have the blue one, which is referring to the cold solution, and we have the red one, which is referring to the warming fluid or blood. So first of all, we need to attach this to IV fluid, okay? And then we attach this to, before we attach it to the patient, we need to do priming. Priming for the cassette to be sure that we don't have any air bubbles inside the cassette. Once we finalize the priming, then we can start the infusion to the patient. Just we need to click on the turn on button, and wait maybe 1 to 2 minutes maximum till it reaches to the 41 degree. 41 degree is plus minus 1.5. So sometimes you will find it 40 degrees, sometimes you will find 42. This is the average of the device, but the setting temperature is 41 degrees Celsius. Okay. So be sure whenever you are start priming, just to be sure that you are opening all the clamp except the patient one. Keep it closed. Once you see the solution come through all the lines, now you can start complete the clamp, the priming, and then close it, and now it will be ready to use with the patient. This is in a very simple way how to insert the cassette and how to attach to the patient. Okay. Now you have the roller clamp. Temperature. The temperature is automatic. It will be set at 40. But the temperature reaches the patient 36 to 37. If you need to have any control on the flow, you have the roller clamp. You can increase or decrease the flow to the patient according to the case of the patient or according to you. In a very simple way. And very important, after you finalize the use of the cassette, now you need to remove it. Because of the pressure of the fluid inside the cassette, if you try to pull it out, it will not. Now it's already doesn't have any flow, so it will come easily. So first of all, we need to reduce the pressure inside the cassette by closing the line coming from the fluid and open the line of the patient maybe to release 2-3 ml. That's it. To release the pressure, to reduce the pressure inside the cassette, then we can remove it in a very easy way. This is a sterile cassette, disposable cassette, can be used with only one patient. And it can be
Is it by gravity? By gravity?
Yeah, by gravity. Yeah. If you need something, for example, life-threatening situation like placenta previa or patient are going to lose high volume of fluids and blood, we have the pressure diffuser. It's a separate device. It will be designed ready to be used with the Ranger. It will provide you with high flow. It looks like two automatic pump working under pressure of 300 millimeter mercury.
Level 1. Level 1 is
Level 1 is another company, but in 3M we have the pressure diffuser. It will be.
How much your pressure diffuser can give in 1 minute?
Pressure diffuser?
Yes.
The high flow set, which is
The highest, yes.
The highest one, by gravity 500 ml.
By gravity.
500 ml per minute. If we use the pressure diffuser, it will be lower.
So gravity is higher than the diffuser?
Maybe no pressure diffuser. It will make it maybe lower than 1 minute. It will make it maybe 30 seconds, 40 seconds.
You didn't give me a number. The number 500 ml in 1 minute?
Yes.
By gravity.
By gravity.
This is for the cassette, the high flow cassette, not this cassette.
Yes, that's what I'm asking.
Yeah. 500 ml per minute. This is for the life-threatening situation.
Yes. So this is by gravity or by a diffusion?
By gravity.
By
If
by
we-
diffusion.
By diffuser, maybe half minute, something like that.
500.
500 maybe in 30
half.
seconds, 40 seconds, something like that. But this is only if you have critical situation that you have to save the life of the patient.
Mm.
If not, we have this one, can provide 9,000 ml per hour, and the pediatric one 6,000 milliliters. But the other, falling in your hospital. If the protocol in the hospital saying that you need to change every 1 unit or 2 units, we 100% need to comply with the protocol and the policy in the hospital.
Usually, in my case, two units per one set, infusion set.
Yes, exactly. This is usually that is what.
Usually, that's practice here.
Yeah.
This is our policy.
This is the practice of Sebastian. 2 units in one
Maximum
two,
volume.
2 units maximum in one set. After the in the third unit, you have to change the set.
Okay.
Yes. So this is what we are.
But this is time constricted. You cannot use 1 unit now and after 3 hours still leaving this set hanged and use another one. No. Once you finish 2 units, 1 unit, and you need to wait, change the set. Change the set.
Oh, I think that even the recommendation of the blood that you have to use it within 4 hours.
If you didn't
Right.
decide, if you units
You have
at
to
the
use the
same
blood
time,
product once you give it, pull it out from the refrigerator. You have to use it and warm it. You have to use within maximum 4 hours according to the American Institution of Blood Bank that you have to use it in maximum 4 hours.
Another question.
Yes.
When I draw this slide, how come the fluid going down? It's a closed system.
No.
No, and I finish. You said when you have to remove the cassette, you have to
Close this.
close it.
And close this.
How will that?
We have 4 temperature setting. We have the ambient. This is which is referring to room temperature. We have 32, 38, and 43 degree. We have 2 fan speed, high fan speed, low fan speed, and then we have 3 indicator. First of all, this is referring to the temperature in range. Then the fault, if there is anything happen to the machine, there is number will appear here in the LSD machine, and this indicator will be illuminated by yellow, orange color. And then the last one, over temperature, if the temperature reach over 53 plus minus 3 degrees Celsius, it will become audible and visual alarm, and this indicator will be illuminated by red color. Okay. So in a very simple way, we need to just attach the hose to the blanket. You have here the store. It looks like a store, but don't fulfill it by the blanket, because at the end of the day we have here the filter. This is the filter. Okay. So if you try to make it fulfilled by the blanket, it will affect the performance of the filter. Okay. This filter is mercury 14, which can catch up to 0.2 micron of the microorganism for the ambient air before it will be transferred through the hose to the blanket. If you don't need to use the rolling card, it is embedded by IV clamp, so you can fix it on the IV pull stand or on the bed of the patient to be more close to the patient. Second thing, we have the hose. Hose, you can feel it a little bit heavy, so that we incorporate it with a clamp so that you can fix it. After you attach to the blanket, you can fix the clamp near to the hose to avoid any movement could happen or deattach of the hose from the blanket. How to attach it? This is a very, very important point, because we get multiple feedback from customers that they say that it's, whenever we are doing the attachment to the blanket will be damaged or punctured. We have wide range, almost 16 type of the blanket. We have some blanket for pedia, some other for adult. We have some for preoperative, some intraoperative. We have some of upper body, lower body, over body, lower body, some for the recovery room. If you are thinking about this blanket, this is mainly used for the recovery room or before the surgery. Sometimes recommended to be used inside the OR, but only if the surgery will be neurosurgery at the area of the head, because it's already full cover, covering the whole body of the patient. So this is the full body blanket that we have fixed on the patient following after surgery in the recovery room. And this is the area of the head. And we have the hose ports here. Okay. A very simple way that we need to attach. If you try to make it face to face, for sure you will facing some issue in the attachment. And usually the blanket will be damaged. So just to make it in a twisty motion. And this is the maximum that you have to attach it. Don't put it inside. Just up to the first line of the leg. If you try to get it to the end, there will be high risk that the patient could have skin thermal injury, especially if you are talking about old patient, diabetes patient. So we need to keep it at the first line of the rating. And then we need to fix the clamp as close as possible. Now we are talking about big size. So we need the high flow set and high temperature. So at the beginning we recommended to start 34, 43, sorry, and the high time speed. Okay. According to the guidelines, monitoring of the core body temperature of the patient is very crucial and critical. So you have to put your eyes always on the core body temperature of the patient. If you find it 36 above, so the patient don't need any warming. If you can feel that the temperature is going to be lower than that, we need to start warming to the patient. Once we find that the temperature, the core body temperature reaches to the normal range, we can shift it to the standby, okay, in a very simple way. If we need to rewarm again, just choose the temperature and the fan speed. Sometimes after 2 or 3 minutes, you can lower it to 38 and the low fan speed, for example, okay, according to the core body temperature of the patient. So if we make it at 43 and the high fan, after sometimes we will start the warming air, start to distribute it all over the blanket. This is in a very simple way how to use a blanket. It takes maybe 2 minutes till it reaches to the setting temperature. And the beautiful of the blanket here that if you notice, just to keep in your mind why Cream or why the Bair brand is very trustable brand in the market. Actually, there are multiple features available in the Bair Hagar, not available in the other competitors, because Bair Hagar was leading the market of the warming disposable blanket. So first of all, we can find what is called central air channel. This is only available in the Bair Hagar. Central air